Hello, my name is Eric Eifler. I'm a board-certified, fellowship-trained orthopedic surgeon specializing in shoulders and knees. I attended University of California, Los Angeles for 4 years for my undergraduate. I attended the University of Texas Medical School for 4 years, and then I went to a orthopedic surgery residency at the University of Texas also for 5 years. After completing that, I did a sports medicine fellowship at the University of Texas for 1 year. One of the most common things I see in my practice in treating shoulders and knees is a meniscus tear. So when you tear your meniscus, usually you're doing some type of activity where you load the knee or twist the knee, and you'll have an onset of pain in your knee and possibly some swelling. Ultimately, you decide to call me. We'll examine you, move your knee around and check your ligaments and check your joint and try to determine what the cause of this pain is. It won't go away. When the meniscus hurts, it will cause swelling with activity. It will cause some catching and some locking. It may let you do a lot of things, but rotational type activities such as playing tennis or when you play basketball or you go skiing, those type of activities may bother it more. In just a 15 to 20 minute procedure, we can take care of that torn meniscus and get you back doing the things you like to do. So in my training as a fellowship trained orthopedic surgeon in sports medicine, I've taken care of a lot of high school athletes, a lot of college football games. I was a team physician for the University of North Texas. And I've seen a lot of ACL injuries in that capacity. Usually when you have an ACL injury, you'll plant your foot and change direction, such as when you're playing tennis or playing basketball or playing football or skiing, and you'll feel a pop in your knee. As far as the treatment for it, it's usually an arthroscopic procedure. That procedure takes usually less than an hour. We rebuild your ACL, we put a brand new one in, and then over the next 6 months to a year, you're rehabbing that knee with a physical therapist and with yourself to help regain the strength in your knee. You'll find that each month that goes on, you're getting better than you were the month before, and hopefully have you jogging somewhere between 2 and 3 months, and hopefully back to doing the things you like to do at around 6 to 8 months, depending upon how fast your quads recover. One of the more common things that I see is a torn rotator cuff. Usually people with a rotator cuff from a traumatic injury will have a sudden onset of pain. They will have pain that limits their ability to raise their arm overhead. It will also hurt them at night sometimes. The more that they try to use it, usually the more it is painful. Sometimes the rotator cuff will tear over time, and just cleaning out your closet one weekend or moving from one house to another and lifting those boxes will aggravate it or cause it to tear more and will cause your pain to be more frequent or more of a problem. Not every rotator cuff needs a surgeon. Sometimes they just need a physical therapist. And so we'll have that discussion and determine what's best for you. If we do have to do surgery, we do it arthroscopically. It's done through 3 or 4 little small incisions that are no wider than your pinky finger. Then surgery takes somewhere between 1 to 2 hours. We see you back usually in a week and start your therapy. Hopefully in 6 to 8 months, we'll have you back to doing things you like to do. Our techniques today, doing it arthroscopically, the recovery is a lot better and it's a lot less painful. I grew up in Oklahoma and subsequently moved to UCLA to go to school and then back to Texas to do my training. I practiced in Texas until about 6 years ago when I moved out to Arizona. All of my family has moved out here over the years, and I was the last part of the family to be out of state. So it's been a great time here in Arizona the last 6 years. I love to golf, I love to trail run. My kids love it here with the outdoor activities, the skiing, the snowboarding. Dallas, as much as I love Dallas, I think I love Phoenix more.